Welcome to TV Agro. My name is Gabriel Rojas, veterinary doctor of the veterinary clinic AutoVet, and today we are going to talk about an issue that is heat stroke. Really, the heat stroke is an increase in the temperature of our pets that is usually because of leaving them enclosed in small places of size, expose them to very high temperatures, or make a physical overexertion of our pets that causes the temperature to rise in them and cause symptoms such as excessive wheezing, mucus gums, eyes have purple coloration. That is called cyanotic mucosa, and that really this type of alterations is an emergency and that can complicate the life of our pets. Then, we're going to talk a little bit about this pathology, or that alteration in the health of our pets that unfortunately get cases to our clinics, and that actually get these kinds of pathologies. Let's say because of carelessness or lack of knowledge of the owners about such pathologies. So what is it? As we have already said, it is an increase in the body temperature of our pets. We have had cases that reach us with temperatures of 41 to 42 degrees Celsius. And the normal thing is that a puppy does not have temperatures above 39 degrees Celsius. Then it is a rise in the body temperature of our pets. Why does it matter? What we were talking about. We humans thermoregulate by sweating. We have the advantage of hiding from high temperatures and more. The puppies, the only way to remove their heat is by panting. Then they, compared to us, do not have sweat glands throughout the body, but simply the way they remove body heat is by means of panting. Then if the temperature rises and suddenly our pets are in a small place where there is not very good oxygenation, because it will have a very big complication, because the temperature will not lower them and will have hypoxia, will have lack of oxygenation in your body, that this can lead to very serious problems such as cardiovascular and in your nervous system. Then it is very cautious and very careful such pathologies. The other thing is also about a physical effort. We spend a lot on Sundays that we usually go out to exercise with our pets, that we go out for a ride in the car where they last a long time locked in the car, or do an over-physical effort in which your temperature rises by exercise, and in the car, for example, do not have a very good oxygenation or have a higher than normal oxygen demand due to physical effort. And there can also enter a heat stroke. What could possibly happen? Brain hypoxia, hypoxia in different parts of the body, lack of oxygenation in the body, and can cause cardiorespiratory arrest. So you have to be very careful with that type of overexertion, about letting it feel in low oxygenation sites or in places where the temperature is very high. Usually for those reasons are the ones that are mainly more. But in conclusion are very high temperatures in places where there is low or low oxygenation for our pets. There are some breeds that are much more predisposed than others. For example, the reason there will be 15 missing the flat breeds that we call, which are the Bulldog, the Pug, the Boston Terrier, the French Bulldog. This type of breeds, the Shih Tzu, which have by their anatomy, because of their phenotype, they have a respiratory deficiency, so sometimes we hear them snoring a lot and they have difficulty walking, or running, or moving. So they come genetically predisposed to a respiratory disturbance because the nose is short, because it has a very elongated palate, and that causes them to have a respiratory deficiency. And if we add that it is in a place where there is hypoxia, that is, where there is no correct oxygenation, where there is no adequate ventilation, and where the temperature is very high. Remember that as they remove their heat by breathing and have that respiratory deficiency, as it will further complicate the picture, then breeds that are brachiocephalic have a Greater predisposition to suffer from heat stroke easier than the other breeds does not mean that the other reason does not give them. Yes, it can give them, but they have greater complication or complicate in an easier way the brachiocephalic flat breeds, as I said before, which are mainly the Bulldog, the Pug, the Boston Terrier, the French Bulldog. The Shih Tzu are the breeds that most come to us here for heatstroke pictures, then by respiratory deficiency that they have complicate the picture a little more. What to do? If you see that your dog has excessive wheezing that does not stop you with anything, your mucus or your gums, your eyes see them purple, which we call cyanotics, see that they cannot, not to breathe that way so fast and excessive, see that they are difficult to move, is to bring it or take it to the veterinary clinic urgently or emergency, because it can really complicate the lives of pets. We hear, and when we get in that picture, what do? We look for a way to lower the temperature to them by placing a fan with cold air, looking for him to gain, put them oxygen. Sometimes we use bronchodilator drugs so that they can breathe a little better, in medication to lower the hyperthermia fever you have, and in some cases very severe, we have to anesthetize or sedate the patient to be able to tube and put oxygen directly to your airways. Then really, if you see that you left your puppy in the car for longer or for a long time and that the ambient temperature is elevated, you have to be very careful with that. We have really seen very severe complications in patients by heat stroke. How can we avoid it? Because it is really simple. One, and what happens most is not to leave the dogs locked in the car, and much more if the temperature is high. Recently happened to us, and I will tell you a case of a patient who came to us, a French Bulldog, where the owner entered a restaurant because to bring some food. He reports that did not last more than 15 or 20 minutes. But he left the windows on top of his car with his puppy inside, and French Bulldog breed. In those 15 minutes the patient was complicated the dog, so that he arrived here for emergency. The dog had a very low oxygen saturation, came in a very marked respiratory distress with his purple mucus completely cyanotic, in which we touched get him into oxygen therapy soon. He touched us by means of external aids, as suddenly with a wet wipe, put him a fan. The oxygen is fundamental, and we had to go to help with medicines, bronchodilators, to find a way to lower the temperature. Fortunately in the case of him we were on time, the owner brought him on time. But he did not know that simply by leaving his puppy 15 or 20 minutes inside his car could have such a severe complication, and that happens to us. We also get many cases when Sundays cycle over, require your dog to exercise, and are usually brachiocephalic dogs. Then you have to take into account that in type of breeds that lend themselves to do physical activities, for example the German Shepherd, the Labrador, the Collies, are dogs that allow to make a much higher physical effort compared to a Bulldog, for example, that they are dogs that their anatomical condition does not allow to be of exercise, or at least of a moderate exercise. Because as it has the respiratory deficiency, because that can lead to problems such as heat stroke, then it is the best way to avoid such pathological alterations is not to subject our patients to elevated temperatures, not to leave them locked up in places where the temperature is very high such as cars, but not to leave them locked up in places where there is no good ventilation. Basically avoiding it is more up to us than them, and if that happens to your pet by X or Y reason, you should bring it right away, because there can be very serious complications and they can compromise the life of your pet. In the case of brachiocephalic breeds that are no longer the dogs most susceptible to heat stroke, we do a surgical procedure in order to improve their respiratory process a little. this type of breeds have two peculiarities, and is that the palate is longer than normal and that prevents the passage of air in a correct or adequate way, so we can do in short a cut in your palate so that the passage of air is as good as possible. This does not mean that you will not give heat stroke and that this procedure is not only indicated for heat stroke, it is a procedure that is indicated for dogs who are diagnosed with brachiocephalic syndrome to improve their quality of life, so that you stop snoring so much, so that you can have more physical activity. And the other procedure we do that we actually do on the same day, that is the set with the cut of the palate, we make the nostrils, which are the holes of the noses, we open them a little more so that the passage of the air towards the nose is the best, because most of those breeds come with very small nostrils, that also prevents the passage of the air in a proper way. Then us, by means of a surgical technique, we make the passage of air more suitable, the amount of air that enters is more appropriate, and that improves a little the quality of life. Of course, it is not a procedure to avoid heat stroke, no, but it is a procedure that makes it at respiratory level. Brachiocephalic breeds improve a lot. Then that is as a recommendation, please in high temperatures do not leave our puppies locked in a place where there is no ventilation to avoid this, because it can really become emergency and risk the lives of our pets. Any questions you have on this subject, on the surgical procedure, please are on our social networks of the clinic, Veterinary Clinic AutoVet, or my personal networks is Gabriel Rojas Vet. There also gladly we can consult. Thank you very much and keep watching Agro TV.